Hi guys, my name is Ton and I'm a first year student pursuing Bachelor of Science in Computing Science in SMU, and today I'm gonna discuss whether virtual reality technology used in surgical training should receive more resources on its development. So for today's discussion, I'm gonna start with an introduction of how important VR technology is to the surgical field. Then I'm gonna explain what virtual reality is and includes some of the most common types of surgeries that use VR technology nowadays. Then we're gonna move on to the discussion of the sources of controversy, where I would talk about the controversial issues that some researchers are concerning about, whether it should receive more resources on its development in terms of cost, difficulty, and in implementation. So for the introduction, in the recent years, the world has undergone a significant development of digital technology, and among that rapid evolution, the development of VR has also progressed significantly. And VR has been more widely used in many areas such as automobile industry, architecture, and also medicine. For many years, surgeons have been struggling with the limited chance of receiving technical training due to the higher cost, ethical concerns, and decreasing resident work hours. They therefore often look out for new technologies that can enhance their operating environment. With the help of VR technologies, surgeries are believed to have higher chance of achieving better medical outcomes and patient experience. VR technology used in surgical training offer high realistic, practical, and interactive values via systematically controllable environment. However, it is still a young field that needs a lot of improvements and resources on its development. Today's discussion we will discuss about why VR surgical training should receive more resources on its development while acknowledging the challenges that some researchers are expressing concern about this new technology. In the 1950s, Morton Healy developed a machine called the Sensorama that is known as one of the earliest efforts in VR. The machine simulated all the sensors through its stereo speakers, a stereoscopic 3D display, fans, smell generators, and a motional chair. However, the project was failed because of the lack of financial backing. But then in the 1960s, he invented the telesphere mask, which is known as the first VR head-mounted display, which still inspires lots of today's VR technologies. Since then, VR has plenty of definitions based on their capabilities at a specific period of the development. The term virtual reality itself comes from Jaron Lanier, who developed a suit with sensors to record body movements. According to Gaddis, VR is a computer-generated simulation of the real or imagined environment or world. The primary elements of VR include a virtual world, immersion, sensory feedback, and interaction. So, to put it simple, VR, the term VR is used to describe a simulated 3D computer environment that responds to user interactions with three characteristics: presence, immersion, and interactivity. Presence and immersion aspect can be understood as a feeling of actually being present in the virtual environment while physically not. And the interactivity of the VR technology allows humans to make changes and obtain feedback from the virtual environment. Nowadays, VR technology allows surgeons to prepare themselves before they enter the room surgeries by practicing medical techniques and procedures in a simulated operating theater. Examples of such surgery include dental surgery, bone surgery, and eye surgery. VR technology is beneficial to surgery because learning in VR provides great interactive value because it encourages active participation rather than passivity. It ensures that students have a better understanding of the materials that they learn. And secondly, VR technology allows learning in settings that are difficult or impossible to experience in real life. For example, students can learn and examine human anatomy better with 3D graphics, and they can freely explore, make whatever changes they want when in real life, ethical values may be considered. And finally, it has practical values as well because VR technology can record all the data during the simulations for future reviewing or evaluation or assessment purposes. One of the most common operations that use VR technology as simulators is laparoscopic operation, which is an operation performed in the abdomen or pelvis using small incisions with the aid of a camera. In the common VR simulators, in laparoscopic surgery training are Lapsin from Sweden, LabMentor from the USA, MISC VR from Sweden, and Simando from Holland. These VR simulators provide surgeons basic skill training and procedural training by allowing the user to perform some of the maneuvers during a laparoscopy by grasping and manipulating. And another example use of VR in surgery is dancing from Israel, which is used in the dental surgery. Dancing provides 3D image of a virtual patient's mouth and gives detailed feedback to the user on their performance. The trainees are also alerted right away by audio signals if they perform any errors. Despite the potential of this new technology, some researchers still express concern about the use of VR in surgical training and whether it should receive more resources on its development. In terms of cost, the difficulty in implementation and its effectiveness over traditional means of training. First concern is that it is costly to design a virtual environment. To ensure that realistic is achieved, virtual reality must be rendered in a very sophisticated way, especially in a surgical setting. Virtual environments require high resolution to demonstrate human anatomy and operational settings as close to reality as possible to guarantee the realistic value and effectiveness of procedural training. If these requirements are not met, the quality of training may decrease, which may then cause serious consequences when the surgeon performs the procedures on real patients. This high requirement in software and hardware capabilities is the reason why VR technology is significantly expensive and is hard to be widely used in the surgical field. And this problem is especially challenging in the area of the world that are already resource constrained in the medical field. However, in terms of cost, conventional training is also costly. For example, surgical training using human cadavers, which are human dead body, has been around for 500 years and is still a gold standard in surgical training nowadays, although its risk of transmitting diseases such as tetanus, hepatitis B, and tuberculosis is well recognized. Moreover, human cadavers are expensive and difficult to acquire, and they have limited time of use and tissues can degrade over time. More importantly, not many national centers have cadaver facilities, which make surgical training using this method even harder. On the other hand, VR simulations allow more freedom to reuse processes data storing and recording, which allow comparisons, analysis, revision, assessment purposes of surgical training. Therefore, although VR technology is expensive, the, the value that it offers will actually be more of a financial gain in the long run compared to conventional training methods. Finally, as wearable technology continue to advance, I think our technologies will continue to evolve and prices will decrease over time. That's why more funds should be provided for the development of this technology in surgical training. The next concern involved with VR technology is that some aspects of medical surgeries are really difficult to be simulated in the virtual reality. For example, density, powerful properties, and convex surfaces are difficult to recreate virtually. Moreover, commercial haptic devices used to simulate drawing have a significant slow response rate and a weak intensity feedback. This pitfall in design cannot capture real-life vibration, which is considered to be not ideal in surgical training when timing is especially sensitive in real-life settings. Another challenge is that VR simulators have to demonstrate the forces that surgeons perform on a particular task accurately and high enough so that it matches the forces in real life. This is a big challenge of VR surgical training as force feedback is absent in most VR systems. Therefore, this is why some researchers express concerns about the practical value of VR technology used in surgical training, as haptic feedback is especially important and can influence how a surgeon performs their procedures on the real patients. To respond to this concern, I agree that VR surgical training still has several technical challenges that need to be addressed. However, taking into consideration that this technology is relatively new to the surgical field, obviously there are still limitations in terms of software capabilities. However, take into account the benefits of VR surgical training, it is believed that it is worth spending more resources on its development. And in fact, some improvements on the VR surgical simulations have been undergoing to increase the level of visual realism, interaction realism, and tactile realism. For example, although still being under further development, some progressions to improve force feedback has been made to the voxel main simulators that support surgical alteration of bridge tissues with haptic feedback. Furthermore, suggestions and recommendations for an ideal VR simulator for surgical training have been realized, such as multimodal training plans, artificial platform, accurate haptic feedback, immersive visual and audio technologies, sensitive input devices, as well as appropriate software with real-time simulation and assessment criteria. Therefore, due to its young age in surgical field, VR technology used in surgery still need a lot of technological advancements and require more resources on its development. To summarize, we have discussed about why VR surgical training should deserve more resources on its development because of the variety of benefits that it offers to the surgical field. And to respond to the researchers' concern about the technology, I think it is financially beneficial in the long run, although is it has an expensive cost at the beginning because of the high requirement in software and hardware capabilities. And also, despite its current technological limitations, I think they will soon be overcome because the technology is evolving very rapidly. And that's the end of my presentation today on the topic of should virtual reality technology used in surgical training receive more resources on its development. Thank you for listening. Do you guys have any questions? And also on the screen is my contact information. So should you have any questions or concerns, please do not hesitate to reach out to me. Thank you.